Hi, welcome to my channel. Today, let's discuss about how to manage a wet cough or a productive cough by using medications. If you're new to this channel, please like and subscribe to get updates on my coming videos. A wet cough is a cough that brings up phlegm and is also known as a productive cough because you can feel the excess phlegm moving up and out of your lungs. This type of cough may be a sign of a viral or bacterial infection, especially in children. When you have an upper respiratory infection, like a cold or flu, your body produces more mucus than usual. Natural and herbal remedies for wet or productive cough are available everywhere, but in this video, let us discuss on what type of drugs can be used to relieve wet or productive cough. Before we proceed, if you have a wet or productive cough that is accompanied with fever for more than 3 to 5 days, please seek immediate medical attention to properly manage your condition. For dry cough medications, you may watch my other video that talks about managing dry cough. Well, there are two types of drugs which can be taken to help manage excessive production of phlegm. These are expectorants and mucolytics. Expectorants makes coughing up mucus easier. This type of drug does not actually stop coughing, which is important because a productive cough should not be suppressed because it is the body's way of removing excess mucus, foreign particles, or microorganisms from the airways. Expectorants also aid in relieving chest congestion that happens because of a cold, a flu, or allergies. The most commonly used expectorant is Guaifenesin. As for mucolytics, these are drugs that dissolves the mucus, making it less thick and sticky and easier to cough up. They are used to treat respiratory conditions characterized by excessive or thickened mucus, such as a productive cough. Common examples of mucolytics are acetylcysteine, ambroxol, bromhexine, carbocisteine, and erdosine. Guaifenesin is available in the form of a tablet and a liquid preparation. In tablets, Guaifenesin comes in a 200 and 400 mg tablet and a 600 mg and a 1200 mg extended release tablet. In liquid form, the drug comes in a 100 mg per 5 ml and a 200 mg per 5 ml oral liquid preparation. The usual adult dose of Guaifenesin is 100 to 400 mg every 4 hours and should not exceed 2.4 grams per day. For the extended release tablet, a 600 mg to 1200 mg may be taken by mouth every 12 hours and should not exceed 2.4 grams per day. Do not chew or crush extended release tablet and should be swallowed whole. As for the pediatric dose of both expectorant and mucolytics, you may consult with a doctor or ask a pharmacist in your nearest drugstore for proper guidance on how much of the drug is to be given and how the drug should be taken. The following are the usual adult dose of each mucolytics for a quick reference. Oral acetylcysteine, 600 mg effervescent tablet once daily after a meal, preferably in the evening. 200 mg granules for oral solution, 2 to 3 times a day after meals. Dissolve in a glass of water and consume immediately once completely dissolved or within 2 hours. Carbocisteine, 500 mg capsule every 8 hours or 3 times a day after meals. 500 mg per 5 ml oral liquid preparation, 5 ml orally every 8 hours or 3 times a day after meals. Erdosine, 300 mg capsule twice a day. Ambroxol, 30 mg tablet 3 times a day, may increase up to 2 tablets 3 times a day. Bromhexine, tablet or oral solution, 8 to 16 mg 3 times a day. Guaifenesin, ambroxol, bromhexine, and erdosine may be taken with or without meal, while acetylcysteine and carbocisteine should be taken with food to avoid stomach upset. While taking any of these medications, drink extra fluids to help loosen the congestion and to lubricate your throat. That is all for now, and I hope you like this video. If you wish to know more about medications, then please subscribe to this channel, hit the like button, and click on the notification button to keep you updated on my upcoming videos. Always remember, it is safer when you know your medication. Stay safe.